This little girl's parents are concerned that she might have Ebola, so they brought her to the hospital. The girl has been suffering from fever, headaches, nausea, and diarrhea. The parents did the right thing by bringing her to the hospital. Now, we cannot tell if she has Ebola without testing her blood. We drew her blood and sent her blood sample to the laboratory in Entebbe. As we wait for the results, we are providing supportive treatment to give her the best chance of survival. This happened a few weeks ago. The girl had indeed tested positive for Ebola, but she's fine today. Patients with Ebola can be treated and they get cured if they are brought to the health facility as soon as the signs are seen. This girl recovered because her parents brought her to the clinic early enough. It is important for the rest of the community to learn how to protect themselves from Ebola. One can get Ebola through touching someone who is infected or their bodily fluids, including blood, saliva, vomit, urine, and sweat. Please don't touch these people, but report them to the nearest health facility immediately for appropriate management. Ebola can also be transmitted through touching or eating meat of some wild animals, especially monkeys and bats. Avoid such meat to prevent Ebola. Lastly, you must not touch anyone who is suspected to have died of Ebola or one who dies suddenly from an unknown cause, unless you are wearing protective clothing. A professional burial team must help to bury anyone who dies of Ebola. Ebola corpses are infectious. You must visit your local clinic and get checked for Ebola if you are having these symptoms: sudden high body temperature, severe headache, feel weak and tired, abdominal pain, vomiting, blood in diarrhea or urine, bleeding from the nose, eyes, ears, and mouth. Please remember, Ebola is a deadly disease that can kill in a short time, but can be prevented. Wash hands with water and soap regularly, especially when in health facilities. Be on the lookout for anyone who has signs of Ebola and get them to the health facility immediately. Do not reject people who have recovered from Ebola. Treat them with compassion. Do not bury anyone who has died of Ebola. Leave the burial team to do it. Together, we can keep Uganda Ebola-free. Report all suspected cases to the nearest health facility immediately. For further information, send a free SMS to YouReport on 8500 or call toll-free on 0800 1000 66.